So, slightly small topic, bronchiectasis. Bronchiectasis can be divided into congenital causes and acquired causes. So, bronchiectasis, what's the presentation? Presentation is foul smelling, copious amount of purulent sputum, ton, okay, a lot of foul smelling, okay. Copious means, okay, a lot of. Congenital, it can be because of cystic fibrosis or it can be because of carcinoid syndrome, primary hypoalbuminemia, okay, or it can be because of alpha 1 antitrypsin deficiency. Acquired causes, it can be because of some foreign body, pneumonia, TB, some hilar lymphadenopathy, right? So bronchiectasis is actually an obstructive disease. It's an obstructive disease, okay, like asthma, COPD, bronchiolitis. These all are obstructive disease. So what happens is there will be marked dilatation of the bronchioles like this. Okay, it's an abnormal dilatation of the bronchi due to chronic suppurative airway infection with sputum, right? Now, what is the pathophysiology? So, bronchiectatic cavities lined by granulation tissues, squamous epithelium, and normal ciliated epithelium. There's inflammatory cells all around, and there is peribronchial inflammation. Okay. Now, this pus may actually open into the uh, pleura, and that might lead to empyema. Okay. Now, persistent irreversible pathological dilatation of the bronchi and bronchioles secondary to the airway destruction. Okay. Now, it could be focal or diffuse, and it's also divided into tubular, cylindrical, and varicose. Okay. Primary and secondary, as I already told you. Now, etiology, it can be because of cystic fibrosis, TB, pneumonia, or it can be because of carcinosis, it can be because of uh, aspergillosis. Okay, aspergillosis. Now, it can be because of aspiration, cartilaginous. GERD can also lead to alpha 1 antitrypsin. Now, there is something which is known as yellow nail syndrome, which comprises of bronchiectasis, pleural effusion, yellow nail, and primary lymphadenopathy. Okay, so there is yellow nail syndrome. So yellow nail syndrome comprises of bronchiectasis, yellow nail, and primary lymphadenopathy along with pleural effusion. Okay. Now, the most common cause worldwide is tuberculosis, and the Western country is cystic fibrosis. Production of the thick tenacious sputum, cup-full sputum, copious amount. Okay. And there can be nail clubbing also. So nail clubbing, there is actually Scamorth sign, parrot beak appearance, which can be seen. Okay, and inspection, you can see that there might be clubbing, right? And signs, you can see, you can auscultate for crackles and wheeze. Okay. Now, pathologically, usually it involves the lower lobes. Okay, so it can be tubular, cylindrical, varicose, and microscopically, there can be dilatation of the bronchi and bronchioles, and that is wider, 4 times wider than the blood vessels. That's written in Robbins. Okay, 4 times larger than the blood vessels. And remember that particularly in CT, there is a tram track appearance. Okay, tram track appearance. Hampton hump is for pulmonary embolism. Very good. Tram track appearance will be there. Tram track. There can be signet ring stage, signet ring, or you can also say that tree in bud. Tree in bud, signet ring, tram track appearance, CT. HRCT is finding. Sweat chloride test can be done for cystic fibrosis, sputum analysis, gram stain and culture must be done. And for the treatment, postural drainage is done. Treat the pneumonia. Stagnation of fluid can lead to pneumonia. You can go for surgery, you can go for mucolytics, but never give mucolytics and cough suppressants together. Okay, give mucolytics and ask the patient to cough. Okay, that's it for bronchiectasis. Complications, it can lead to cor pulmonale, respiratory failure, empyema, long abscess, septicemia, MODS, death. That is same for all. Okay, thank you.